instead of a primary care physician, and the ER sees something funny about that injury, well, there's another mandated reporter. So you bring up a very good point. No, no, not unless you have a background, in child services. And one more thing, and then we need to move on so we can get done.
I was just going to say, both sets of my grandparents came over on the boats to Ellis Island and stuff. But they went into neighborhoods where their languages were spoken. And they immediately had a support system of people helping them out and stuff like that. Unfortunately, living in where we live, we don't have those kind of communities anymore.
That's right.
They're not ethnic based as they were, for example, in Cleveland, where I was from. And that's so much more difficult because you don't have anybody to talk to, anybody to lean on.
That's right. We do have some places in the county where there are certain people groups that tend to live more in one space, but I have to say that right here in Fairfax County, we don't have the equivalent of in DC, we have the Eastern Market area in Chinatown, and then you hear even about places in California where there's a heavily populated Hispanic area, that sort of thing. We have pockets here, but it is different in Fairfax County. Okay, a little bit more information for you. There's something on there that says temporary assistance for needy families. That was one of the slides I was going to show. Just want to let you know that temporary assistance for needy families is something that many of the families that you encounter will be receiving. And that is Virginia's welfare program. We don't like to call things welfare anymore, but that is that reformed welfare program. And you can, as an individual in Fairfax County, actually in the state of Virginia, receive temporary assistance for 2 years at a time for a total of 5 years as an adult. So you can receive 5 years of TANF as an adult. If you happen to be a child in that family, those 5 years don't count against you. So as a child, you could be on TANF for many years, and then as an adult, it starts over for you. Those years are not counted against you, okay? And I want to pull out a few more facts about that, so just bear with me. If you receive TANF, you must sign an agreement of personal responsibility that you will in fact seek work, that you will get your children in daycare by using county services, that you'll utilize transportation services, that you'll do certain things to transition your family from not being self-sufficient into providing for itself by working and other things that the family can do to strengthen itself. Now, after a family receives TANF for 2 years, it stops, but they can still receive some of the supportive services, such as the transportation and the daycare. So they don't just drop you and say, that's it. You can have 12 months of continuing services, but you have a 2-year gap before you can start TANF again. VIEW is the next slide. VIEW is Virginia Initiative for Employment, Not Welfare. And you will have people that you are working with that are in the VIEW program. And in order to get your money from TANF, you have to be enrolled in VIEW. So this is, once again, remember when I said that the federal government didn't first design things to get people out of poverty, it was just a Band-Aid? This is designed to help families become self-sufficient. So VIEW, they get a caseworker, another mandated reporter. They have a caseworker, they have to maybe meet with a job coach, maybe they go to classes to learn about interviewing skills, putting together a resume, maybe they help them earn their GED. So the VIEW program does a lot of things with the families in Fairfax County. And if they do not comply with VIEW, they can be sanctioned. This just happened with one of our families last week, and now they've lost their TANF for this month, and they have a 19-year-old baby. 19-month-old baby. So it's very important that the families meet with their case managers. As a CASA, you're calling the VIEW program to make sure they're doing everything that they need to do. If you are on TANF, there are some exceptions for people who can't work, and that would be and they have to enroll in VIEW, but for some people they don't have to work. And that would be people who are at least 4 months pregnant, I believe. And I have a list here I'm just going to read from, so forgive me. If they have someone in the home that they need to care for and they're the only caretaker available, that would be something where they don't require them to have a job. If someone is mentally or physically unable to work, someone who's 16 to 19 years old and is currently in school, and then also someone who is 60 years of age and older is not required to work, even though they may be receiving TANF. And I'd like to bring up one other fact. People say, well, people in poverty, they're not really working. As I said, this is one of the myths. A lot of the people in poverty are not of working age or they're on disability. Remember when I said that I think it's 25% of the population in Fairfax County, I said that this past Saturday, are children 18 years of age and under? So not all of those children are able to work, and I told you earlier that about 670 children are homeless in this county. They can't work. So part of the reason that people who are in poverty are working is that they're just not of that age, or they're elderly, or they're disabled. So keep that in mind as well. Now we are to my favorite part of doing poverty, and it is an activity that I'm very excited to do with you. I need you to flip over the handout that I gave you, and it's numbered 1, 2, 3, and 4. It's on the very back. I just want you to flip it over. Everybody should have a 1, 2, 3, and a 4 on the back. Okay? And what I did when you were doing your last activity is I went around the room and I placed cups in front of you, 1, 2, 3, and 4. Here's what I want each of you to do. I don't want you to just open up everything at once. I want you to go ahead and take the paper from number 1 and don't unfold it and place it on number 1. Take a paper from cup number 2, put it on number 2. Take a paper from cup number 3, place it on number 3. And there are lots of cups, so just reach out in front of you, help your neighbor get theirs. Just make sure that the 1 goes on 1, 2 goes on 2, 3 goes on 3, and 4 goes on 4. Okay, does everybody have their 1, 2, 3, 4 papers? I went like this, 1, 2, 3, 4, 4. Number 1, go ahead and open it. You are now giving birth. Some of you have never given birth before. This is a shock. You are now giving birth. These are your children. Now go ahead and open up paper number 2. This is going to tell you whether you are a single parent or whether you are in a household where there are 2 parents. Number 3, go ahead and open it. That is your rent for the month. That is how much your rent costs for the month. Okay? And number 4 is your salary for the month. And if you have a 2-parent household, go ahead and take one more salary from cup number 4. So if you have a 2-parent household, you are allowed to reach over and take out another salary. I bet you can guess where I am going with this at this point. Now, 3 people in this room have an orange dot in the upper right-hand corner of their paper. Raise your hand. Yes, a red dot. Okay. Those 3 people are actually on disability, so I'm going to reduce your salary or your income to about $680 a month. So whatever you have, go ahead and reduce it. That's your income. Okay? Here's what I want you to do with about 7 or 8 minutes of your time that we have left. I want you to survive on this budget for 1 month. And I want you to remember everything that you need to survive. And I'm going to walk around the room and kind of help you remember. I have put right on the other side of that paper some hints about how much it costs for daycare, how much it costs for health care for a month, how much it costs for bus tokens, that sort of thing. But go ahead and start now. Figure out your budget for a month. How will you survive? You need to have food. You have to pay for utilities. If you are going to use a car, you will have a car payment. If you want a computer, maybe you have internet access. How much is your internet going to cost a month? Do you go to the gym? Because you might not go anymore. Okay, I want you to really think about what it is that you need to do to survive on this budget. So you need to survive on that salary for 1 month. I need you to do line items. How much you're going to put aside for food, how much you're going to put aside for utilities, how much you're going to put aside for health insurance. You have to try. Think outside of the box. Think outside of the box. What things have you learned so far that are available to families? I need you to think outside of the box. There are some services available. $389. In Fairfax County, you get about $430 a month for TANF, just to let you know, only in Fairfax. Do you need health care? Do you need daycare? Remember, daycare is $800 a month. And remember, if those children are under the age of 5, someone has to watch them during the day when you're at work because they're not in school. So you have to have daycare. Someone has to be watching your kids. And if it's you, then that means you're not working. So Some of you have pets right now. You might not be feeding your pets if you're on this kind of budget. Think of the things. Do you ever get your hair done? Do you get it cut? Do you get it dyed? Might be something that you have to let go of if you're on this budget. Do you get pedicures or manicures? Some of us ladies like to do that. Probably going to scratch that from the budget too. What do you have to cut to survive? And just keep in mind that you're just trying to survive for a month. Let's think about even the whole year. Do your children have birthdays? Do you want to celebrate with them? What about gifts? What gets cut from a budget when you have to survive? What can't you do for your family? How many of you go on vacation every single year? How hard would it be to go on that vacation when you are scraping by like this, just to get away and relax? Medicaid is available for children and for parents as well if they qualify. Medicare is for people who are over a certain age or who have a disability. So Medicare isn't what we use for the children that you're serving, unless they have some sort of disability, and then maybe they could receive that, but it would be Medicaid. Yes, Fairfax County has free health department clinics. We can go and get immunizations and
Be seen by a doctor if you get.
I'm not even, yeah, maybe, I'm not even sure. You have just another couple minutes. I know I'm pushing it. It's hard to think of everything, but imagine too that you're a parent whose child has been removed and you have to get a court-appointed attorney because you can't afford your own. It makes a difference. It makes a difference. If you're enrolled in TANF, if you're enrolled in the VIEW program, the county does offer some assistance with daycare. They may actually fully fund it while the child is in care, but if you're enrolled in the VIEW program, yes. And I don't know how much of that they cover, but they will assist. Sure, if you want to think outside the box and say they're in TANF. Okay, how many people here were born in the month of July? Okay, just one person? How many people were born in June? February? Okay, February, June, and September, raise your hands. All of you are now here in the United States illegally, so you no longer qualify for Fairfax County services. So if you've put TANF, VIEW, anything, it's gone. I just want you to know that.
Now, does VIEW give added financial benefits to TANF, or is that?
You have to be enrolled in VIEW to receive TANF, so no, it doesn't. But you do get the job coaching and the resume, GED assistance. About, I think, a little over 400 in Fairfax County. You do have to sign an agreement that you will work, that you will be looking for work. Yeah, that's fine. We're going to say that you do because we're thinking outside of the box. Yes. Okay. I'm going to go ahead and wrap this activity up. I know that you probably are nowhere close to thinking of everything that you have to consider. But did anyone survive? Do I have a survivor? Okay. I have some people who survived. How did you survive?
Well, I think I survived.
Okay, let's talk about it.
It's a two-parent household with one child that's 6, so then I'm assuming this child will be able to go to school. The salary together is $1,641. The rent's $759. So they basically got $882 left. It's not a lot, but there are free clinics. There are clothes closets. I think you could get by if you had to. I mean, if the rent is that low, then the utilities might already be included in this rent.
Sometimes utilities are included.
Yeah, so I was thinking that might not be too much.
Okay.
I think they could survive.
Okay.
Is there federally subsidized housing, like public housing is available?
Yes, there is.
To reduce your rent?
Yes, there is. But I have to tell you, just so you know ahead of time, the wait list for Section 8 housing, and it's called something else now in Fairfax County other than Section 8, it is so long that in the meantime they have to have a place to live. And I'd also like to add for people that are saying, well, I scraped by, what you didn't include here is probably gifts and Christmas and things like that, holidays. And so this is this is bare bones for the people who are scraping by. And I remember in Prince William County, when they did the Angel Tree there, they used to let anyone who said that they had a need be involved with the Angel Tree. And then they decided, no, you have to go to social services and be found to be at a certain poverty level in order to receive that. Well, what happened was all those families that were barely scraping by, they didn't meet the requirement for poverty yet, but they were right there. They lost that, you know? So as a CASA, you need to remember, you may have families that are just barely scraping by, but those extra things like the puppy for the kids and the gifts and that sort of thing that are more fun for the kids or some stress relief, that goes out the window when certain things change with services. Okay, I think I can take maybe one or two more if we're in a hurry, if we hurry. So you said that you survived.
Well, I think I did, because when you told me what the, whatever color that is, document, that means that I qualify for Medicaid or Medicare.
Medicare.
Either way, probably.
Right.
So I have no health insurance costs. My child would be covered by the CHIP program. So, and I thought the WIC program was really generous, and I guess that's how I robbed the bank.
Oh, I see. Okay. And
But, you know, with my disability income, food stamps, and the WIC program, my income is well over the exorbitant rent I'm paying, and I think I have enough to feed the child and myself at least.
Okay. Lisa, did you want to add something?
I just wanted to make you aware that you might be squeaking by, but if you're in a stressed situation, you might be spending money on drugs and alcohol.
Thank you, Lisa, for that reminder. She's exactly right. What we're not adding into this equation is that many of the parents that you will be involved with as CASA volunteers may be dealing with substance abuse, mental health issues, or both if they have a co-occurring disorder, and you can sometimes be required to pay for those services, you know, when the county says that you have to do them. So it can be a lot of money. How many people were surprised, just by a show of hands, in thinking through this, about how much you really had to think about and what it would really take for you to survive if you were closer to the poverty line or near the poverty line? Yeah, it's extremely difficult. So I appreciate your patience and you trying to think outside of the box. And I wish we had time to talk about how more people survived or barely scraped by, but we don't. But I really enjoyed working with you today, and I hope that it kind of gave you a glimpse of what some of our families are dealing with. And for those of you who could not pay your rent, just remember when you see families and people say they have 10 people living in there, someone needs to report this, okay? Why would I have 10 people living in my house? I've got to somehow survive. I've got to be able to afford where I live. And if 10 people are in there contributing, then maybe I can. And oh, one of them just molested my daughter, and now I'm in trouble with CPS, and all I was trying to do was provide for my family. So we need to be sensitive as CASA volunteers and think about what people who are in poverty are experiencing.